Hello, Assalamu alaikum. In this video, we will understand about the vasculitis, the inflammation of the blood vessel. Let's understand about the large vessel, vasculitis, middle, and the small. So we will collectively understand the general overview of the vasculitis, and then next video we will understand further. This is the aorta and the heart, and this is the descending aorta, and this is the renal blood vessel. The large vessel vasculitis occur in the aorta, while the middle vessel vasculitis can occur in the renal blood flow to cause the glomerular nephritis or the mesenteric vessel, the mesenteric artery, while the small vessel vasculitis is the capillary is involved. This is a bigger picture of the blood vessel which that contain a lumen. Inside of the lumen is the leukocyte and the RBC, the red blood cell. This basically is the tunica adventitia and the smooth muscle layer is here. The smooth muscle layer is the tunica media, while the tunica intima is the innermost, is the endothelial cell containing blood vessel. Antigen presenting cell and dendritic cell immature is present in the tunica adventitia, while the antigen presenting cell are present in the lumen, and the antigen representation through a pollen or virus or other antigen. And after the sensitivity, the hypersensitivity will occur, will lead to activation of the T helper cell, the CD4. And this, when going to the lymph node, this antigen presenting cell to present the antigen to the CD4 T helper cell, and this CD4 will activate the CD8, the cytotoxic T cell, and the B cell. B cell activation to proliferate and to produce a plasma cell. Plasma cell is a ability to produce the autoantibodies. These autoantibodies cross react with blood vessels and the molecular mimicry will occur. This molecular mimicry will lead to attack the endothelial cell of the blood vessel, while the antigen antibodies complex formation also occur, while on the other hand the mast cell has an allergic reaction response. This autoantibody bind with the Fc receptor of the mast cell to degranulation to produce histamine, leukotriene, will lead to vasodilation of the blood vessel, endothelium dysfunction, and inflammation and infiltration of neutrophil. This is the separate understanding mechanism, but we just understand about the neutrophil mechanism. Let's understand about first of all the antibodies can react to the endothelium. In this way, the endothelium will collapse and the dysfunction of the endothelium will occur. This is the cross react with blood vessel. The molecular mimicry will occur. In this way, this is the target the antibodies to the endothelium and also the antigen. Anyhow, let's understand about the neutrophil activation and how neutrophil can activate. These autoantibodies, the IgE antibodies, basically, which that is basically react with the neutrophil, and this when also react with the endothelium to dysfunction, lead to cause reactive oxygen species enhancement, as well as neutrophil will bind with the light chain site of the antibodies, and the neutrophil immature activation will occur and to produce chemokines, while the CD8 and CD4 also activation to produce the cytokines, and also will lead to cause inflammation in the tunica media, the smooth muscle layer. In this way, this is the chemokines produced from the neutrophil will target to the smooth muscle layer of the blood vessel, lead to cause inflammation, while on the other hand the dendritic cell activate to produce the chemokines and also activate the CD8 and CD4 T lymphocyte, and the complement activation will also trigger the inflammation. Complement activation also basically for opsonization of the endothelium, as well as it will lead to endothelial cell lysis, and the endothelial cell lysis as well as the phagocytosis of cells. Phagocytosis of the cell is due to the macrophage involved. The cytokines produced will lead to response of inflammatory response. Anyhow, this is the lumen again I am drawing. This is the WBC and the RBC are present. This is the endothelial dysfunction. Rupturing the lysis of the endothelial will produce the cytokines and wall debris. As well as here is the inflammatory response will occur from the WBC due to the cytokines production from the endothelium, and in this will lead to recruitment of the WBC. The major is the neutrophil will infiltrate into the smooth muscle layer of the blood vessel. In this way, the leucoclastic palpable purpura will occur. So this is the basically you can understand as well, and in this way the basically you can understand the drug induced vasculitis, viral and other syndrome can occur, which that will lead to cause these type of vasculitis. And this vasculitis is basically tunica adventitious here, smooth muscle cell layer, and this is the lumen and the RBC. So anyhow, let's understand the picture of this is the leucoclastic palpable purpura, which that is looking like this structure. And with the inflammatory response, which that will lead to injure the wall debris, which that will lead to trigger the hemostasis. This hemostasis basically will lead to platelet plugs and coagulation of the RBC. The thrombosis formation will occur, and this will lead to cause rupture of the blood vessel often. Anyhow, it is also obstruct and impede the blood flow, which that will lead to cause stroke also, aneurysm also possible. The elasticity of blood vessel will decrease, will lead to stenosis, ischemia, necrosis, as well as the aneurysm. This is the coagulation, which that will lead to clotting factor activation and the clotting of the blood flow. The blood RBC clotting and the platelets plug formation, which that will lead to clotting, and in this way it will lead to cause many problems. Like the endothelium dysfunction will lead to stenosis, ischemia, necrosis, and aneurysm. This basically is lead to cause the damage, and in this way the sign and symptom of the vasculitis, the generally the fever and the weight loss, fatigue, and the general itches and pain, as well as headache. While on the other hand, the common symptom and the more progressive vasculitis will lead to cause many other like problem. This is the general, but the other is we will understand now. The basic is the reduce the visual acuity, the stroke can occur, bleeding of the nose due to the blood vessel rupturing. On the other hand, if we will discuss about the lungs, the blood cough, lung inflammation and infiltration. For heart is the myocardial infarction and hypertension. For skin, the palpable purpura and the joint, the pain and arthritis. For the digestive system, as well as for muscle, the muscle can pain, the glomerular nephritis in the renal, in the nephron, while the digestive system will lead to blood stool and abdominal pain. This is the vasculitis, the video about the vasculitis. I hope you make sense about that. Vasculitis is the inflammation of the blood vessel, especially the artery. And in this way, the blood flow problem and a lot of sign and symptom can occur. Thanks for watching. If you like my video, please make sure to subscribe, like, and share. See you in the next video. For this one, bye.